How to assess the occlusal plane during smile designing. Let's get this right and avoid the number one error in both functional and aesthetic outcome. Save it and share it. Facial and extraoral reference alignments. The occlusal plane is visually perceived in relation to the patient's face, not just the teeth alone. The interpupillary line serves as a key horizontal reference in the frontal view. Ideally, the occlusal plane should be parallel to this line, providing visual harmony when the patient smiles. In profile, the ala-tragus line or the Chembur plane offers a sagittal reference. The occlusal plane typically aligns parallel or slightly downwards anterior to this line. Dental midline and cant evaluation. Smile aesthetics are highly sensitive to even small discrepancies in the occlusal cant. Use a digital lever, facial midline marker or aesthetic ruler to identify any occlusal canting. A cant of more than 2 degrees can be clinically noticeable, especially in high smile line cases. This should be corrected prosthetically, orthodontically or surgically depending on the etiology. Smile curve and incisal edge position. The incisal edges of the maxillary anterior teeth should follow the curvature of the lower lip during a post-smile, creating a pleasing smile arc. Flattening or reversing the curvature can make the smile appear aged or unaesthetic. Incisal display at rest is critical. Young adults typically show 2 to 4 mm of central incisor display, which should guide the occlusal plane determination. Vertical positioning and the occlusal plane pitch. Sagittally, the occlusal plane should be assessed against the ala-tragus line. Incorrect pitch can lead to compromised aesthetics and phonetics. Over-eruption or infra-occlusion can also distort the plane, requiring equilibration, prosthetic correction, or orthognathic evaluation. Clinical tools and aids. Analog, Fox plane, Facebow, tongue depressor, aesthetic ruler. Digital, 2D smile analysis software, intraoral scans, 3D facial scanning can overlay the planes for precise alignment. Photographic analysis, standardized frontal and lateral photographs help verify the reference lines. Functional correlation. An aesthetically ideal plane must also respect the functional occlusion. Proper anterior guidance, mutually protected scheme, and vertical dimension must be confirmed. Any adjustment should be verified in dynamic movements, which is protrusive and lateral excursions. Verification in the upright position. Facial musculature, gravity, and lip dynamics alter when lying down. Final occlusal plane assessment should always be performed with the patient sitting upright to reflect the natural head posture and smile dynamics.